Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people find answers who have chronic conditions, chronic health problems. All right, so today we are going to talk about iron deficiency. Iron deficiency is so prevalent, especially in the United States, well, actually all over the world, but it's not seen as, hey, this real top of the list important thing. And I want to talk about how important it really is and kind of how undervalued it seemed to be. All right. So the first thing is when we see patients come in, I'll have a patient come in and say, maybe I have a thyroid problem, or maybe I have an adrenal problem because I'm tired all the time. I'm having hair loss. I'm feeling cold. And yeah, a lot of these symptoms could mimic a thyroid problem, maybe even an adrenal problem. So that's the reason why, too, we can't really just guess and say, hey, maybe you have this, maybe you have this. We've got to say, wait a second, let's maybe look at a blood test and see if there's some issues with some different things. Because another thing that can mimic so many conditions is low iron. Iron is, let's put it this way. Your body, the human body, only has two types of fuel. Fuel meaning the way we make energy. And one of those is blood sugar, which we're not really talking about today. The other one is oxygen. We have to have oxygen to live. So how do we get oxygen from the air to our cells? Well, number one, yeah, we breathe it in, but then it has to go into our bloodstream. And once it gets in our bloodstream, it's got to be put into red blood cells. And those red blood cells, in order to carry oxygen, have to have iron. Iron's extremely important. So if you don't have iron, you can't get oxygen to your cells. And if you can't get oxygen to your cells, that's scary. That can cause all kinds of problems. Just like if maybe your blood sugar dropped extremely low. Again, those two types of fuel are crucial. So let's dive right in with some different factors here that go into iron deficiency. All right, so these are some signs and symptoms. If you have low iron, the biggest thing probably on the list is you're going to have fatigue. I mean, that's right up there, probably number one on the list of things to look at. The other thing, when I say pallor, that means we're losing a lot of our skin tone. A lot of times when people are iron deficient, their skin will look more white, maybe even bluish tint to their lips or their eyelids. Yeah, that's when they're really getting low on iron. You're getting less oxygen to cells. And so, yeah. And then the other thing, too, is if you decrease oxygen because you're low in iron to the brain, yeah, brain fog. When I say low cognition or decreased cognition, yeah, you can't really focus. You can't concentrate. Your memory's getting worse. You just, overall, I can't think straight anymore. And then the emotions. In order to make neurotransmitters in the brain, serotonin, dopamine, GABA, acetylcholine, you have to have iron. It's one of the main cofactors in the production of neurotransmitters. So if you are low in iron, you can be an emotional wreck. Feeling cold. So if you low iron, you low oxygen to your cells, yeah, you start to feel cold. Maybe it's just hands and feet at first, but then it can be all over. Some people are just saying, yeah, I'm just cold all the time. Now, there's other causes of that. Maybe low blood sugar or hypothyroidism. Yeah, there are some other possibilities, but iron would be one of the first things you'd want to look at. All right. Headaches, yeah, definitely. Low oxygen to the brain. Now, this is interesting. Brittle nails or spooning of the nails. So, yeah, the nails will break or tear easily. But when I say spooning, that means the nails kind of cup up. It's like you could pour a little water in your fingernail and it'll just hold it like a little cup. Yeah, that's spooning of the nails. But they become very brittle hair. Some people get increased canker sores with low iron. Restless leg syndrome. What will happen is if you're low in iron, your heart starts to have to beat faster. You get increased heart rate because you got to get more oxygen to your cells. Shortness of breath. Pica. If you haven't heard of pica, this means you start to crave stuff, not food. You're craving dirt. You're craving eating something, plastic, or, there's all kinds of things you'll just start to chew on and eat that are not food. And you're just your body's looking for minerals. Chest discomfort, all these things can go with iron deficiency. So yeah, the symptoms are important. and that can make you feel lousy. But then we've got to say, why is this happening? Because there's always a reason you're low in iron. People aren't just low in iron for no reason. Iron comes in through the diet. So let's keep going here. All right. So usually there's three main causes. Either you're not intaking enough, or you're not absorbing it, or you're losing it. Those are the only real things that can happen there. So if we're consuming, if we're trying to consume it, or maybe we're not consuming it, the one I put on there is kids drinking cow's milk. It's been shown in the research that in the first year of life, if kids are drinking cow's milk to get their nutrients, they are going to get iron deficiency. Number one, well, let's put it this way. During those early years, yeah, breast milk will have everything you need, everything a baby needs. But if let's say you say, oh, I'm going to switch over to cow's milk. Cow's milk alkalizes the stomach. The stomach has to have acid in order to absorb iron. Plus, cow's milk doesn't really have a lot. I hate to say, the dairy industry isn't going to like me after this video. Sorry about that. All right. Vegan or vegetarian diets. A lot of people think, gosh, I eat dark green vegetables. I eat spinach. Spinach is high in iron. I'm going to talk about that in a minute. We're going to go to an actual study or textbook, medical textbook on why you can't really get iron very much from a vegan or vegetarian diet. So we're going to get to that. So hold your horses on that one, because a lot of people are going to say, what? Wait a second. That's how I eat. What do you mean I'm not getting iron from that? We'll get there. Next, let's go to malabsorption. So this is really important. If you have a gut issue, which so many people have, now if it's a diagnosed gut issue, if you have Crohn's, colitis, IBS, celiac disease, any type of gut issue, even if it's a gastritis or some of these that I didn't even list here, yeah, you're not absorbing. The majority of iron is actually absorbed in the very beginning of our small intestine, the duodenum and the jejunum. So these are really crucial areas where the iron comes into the system. And if you've got gut issues, it's not going to happen. You're going to get low easily. And you don't even have to have one of these diagnosed conditions. A lot of people have gut inflammation. If you have food intolerances, you most likely have gut inflammation. If you are noticing, hey, I'm constipated a lot, or I have a lot of diarrhea, you probably have gut inflammation. Again, but the key is just finding out what's causing that gut inflammation. Another one here, antacids. If you have reflux or heartburn or indigestion or any of these things, and you're like, gosh, I got to take an antacid after I eat, or during the day, or at bedtime, or I wake up and I've got an acid stomach or reflux and I've got to take my antacid, or I'm on a PPI drug, all those things prevent stomach acid formation. So what happens is, in order to break down iron, metabolize iron, digest iron, you have to have stomach acid, and good stomach acid, not the bad acid. When you get heartburn or indigestion or reflux, that's because food's fermenting in your gut because you don't have enough good acid to break it down. Inside of our bodies, close to 100 degrees, so food starts to ferment or rot. And I know that sounds horrible and gross, but if food's fermenting, it makes bad acids too. And these bad acids are the ones that cause, but they won't digest your food. But so we have to have good acid levels. And then surgeries. If you've had any type of intestinal surgery, gastric surgery, one we'll see a lot is patients who've had gastric bypasses. So again, their stomach is now very small. It's to help them lose weight, but at the same time, they've just limited their stomach acid. They're going to get deficiencies in a lot of ways, but iron can be one of them easily. So another way is iron loss. This is really common too. What can happen? So if your red blood cells are dying off, that's hemolysis, or if you are hemorrhaging, if you're bleeding internally or externally, and these can be due to traumas, inflammation, menses. This is probably one of the most common one is women will say, hey, I'm having a really heavy period. And even not only that, but I'm having it multiple days in a row, losing lots of iron out of their system. Endometriosis, a condition that can commonly create this too. So again, if you get some wound that's bleeding regularly. I mean, so many possibilities here. You can lose iron. Hemorrhoids, if you are bleeding regularly through the hemorrhoids every time you go to the bathroom, yeah, you can start to run low in iron. GI bleeding. Now, GI bleeding, you're not going to really see. If you have a hemorrhoid, you're usually going to get more of a bright red color on your toilet paper or in your stool. When it's GI bleeding up higher in your gut, it's usually going to be a darker blood that you're going to see on your toilet paper or in the stool. GI bleeding, not a good thing. There's a reason, there's a cause for this. You got to figure that out. Cancer, yeah, if you've got especially colon cancer, you're losing blood. Nosebleeds. Some people get some bad nosebleeds and they can go on for long periods of time, or they regularly get them. The capillaries are breaking in their nose. There's reasons for this, which are usually deficiencies. Then again, we're losing blood. Urinary loss, a lot of times either with urinary tract infections or sometimes other issues affecting the urinary tract can cause bleeding. And sometimes you can't even see it. Sometimes it's so light you won't notice it unless you wiped with the toilet paper and it looks a little blood tinged, or you get a test and it's like, hey, there's some blood in your urine. Here's one that people don't even think about or consider, or doctors don't even consider: parasites. So we'll see patients that their iron is low, what's called their ferritin, which we'll talk about in the future, is low. It's their body's low in iron. They're not bleeding. They don't have all these other issues. They're intaking iron foods. Everything else is pretty good, but their iron's low all the time. We'll find that parasites are an issue there. So that's another potential cause. And then another one that's thought of too is uterine fibroid. Uterine fibroids tend to, it's called, they kind of suck that iron in and cause them to grow sometimes. So this can also be a robber of iron. So definitely some different causes. Now, times when you need to increase your iron too would be if you're pregnant. Yeah, you probably need to increase your iron. The times you don't want to increase iron is usually if you have a lot of inflammation or some infection, because if you're highly inflamed and you take iron, this could cause what's called a Fenton reaction, and sometimes it can be like pouring gas on a fire. And this is oftentimes why people on their blood test will have a low serum iron, the amount floating in their bloodstream, but their ferritin, the iron stored in their liver, will be high. So they've got plenty in their system, but the liver's not letting it go due to some inflammatory factor. We're not going to get in the depths of that in this video, but let's go on to, I want to talk a little more about this, because I think this is a big question that I have from a lot of patients. And this is one of the reasons I did this video, because they're like, wait a second, Dr. Pickel, you're saying that I don't get iron from my veggies very well. So let's talk about why. So inhibitors of iron absorption include phytate. So what the heck is phytate? Phytate's in vegetables. So plant-based diets, found in plant-based diets. So the thing is these phytates actually inhibit iron absorption. So you can eat these great veggies, but your phytates are decreasing your absorption. Now, another one too are polyphenols. These are found more in like teas, black teas, coffees, wine, legumes, cereals, fruit, vegetables also. And these also inhibit iron absorption. So the thing is there's some others here too I want to get to. But the thing is yeah, so don't think just because you're eating a lot of spinach, you're eating a lot of dark green vegetables, which would typically have iron, that you're getting your iron supply that you really need. Because a lot of people will depend on that, especially if you're a vegan or a vegetarian. Now, also on the animal protein side, we even have some issues here too. If you do a lot of casein, which is dairy, if you do a lot of whey, egg whites, again, here's these proteins from plants like soy. These also inhibit absorption in humans. And another one, oxalic acid. Who's heard of that? Spinach. That's number one on the list when you're low on iron, right? Wrong. Chard, beans, nuts. They bind and inhibit iron absorption. So all these things that, if you actually look on the internet and they'll say, eat these if you are vegan or vegetarian and you are low in iron, eat these things. If you look at the biochemistry of it, doesn't work. I mean, you may get some. I'm not saying you're not going to get any. And if you're, maybe, eating a ton, maybe you'll get enough to get by, but iron's pretty darn crucial there. Now, things that actually help that they note: vitamin C, which can overcome the effects of dietary inhibitors when it's included in the diet with non-heme iron availability. So this would be part of your answer if you're maybe eating a plant-based diet. If you're a vegan or vegetarian, what you may need to do is when you eat this, eat your veggies to get your iron, you may have to also take a large dose of vitamin C to help transport it in. Vitamin C is amazing in that it helps transport iron into your body. Now, the thing is they'll call it heme iron versus non-heme iron. Let's put it this way: heme iron means it's already in the hemoglobin. So if I eat some meat, red meat, chicken, turkey, any type of meat, that meat inside of it has red blood cells. And inside those red blood cells is iron in the heme form. Heme means hemoglobin form that's already in my system. So my body, when I eat that, says, hey, I can use this right away. This is the exact type that I put in that's in my body. We can absorb this. We can utilize it. Fantastic. Now, if you get plant-based iron, you're getting a non-heme form. The body sees it and it says, hey, yeah, that's iron, but it's not the kind that I utilize real easily. So again, digestive processes, the process to get it from point A to B, it takes a lot longer. It's a lot tougher. So you need things to help with the absorption. And I would say on top of this, the pH of the stomach is crucial. So if you are taking iron, you want a acidic environment. When does that occur? That occurs when you sit down for a meal and relax, and you got your plate in front of you, and you're not doing a bunch of other stuff and running around. You're engaging your parasympathetic nervous system, your rest and digest system, not your fight or flight system that's been getting you around all day long. So you need to relax, maybe take a few deep breaths, allow that stomach acid to start thinking about your food. Your mouth should start salivating. You're going to get increased acid production. These are this is producing the good acid in your stomach, the optimal environment. Don't drink a bunch of alkaline stuff while you're eating. Don't drink alkaline water while you're eating. Don't alkalize your stomach. I won't get into all the details of that. That's actually, I think, in another video about how stomach acid triggers the rest of digestion to occur. But I hope everybody enjoyed this today on iron and got a lot of information about it. I actually, probably another video, we're going to talk more about the blood findings and what to look for on your blood in regards to iron, because most doctors, when they check your iron, rarely do they even check your iron. A lot of times they'll just check your hemoglobin. And they'll say, oh, your hemoglobin looks fine. You're not iron deficient. You're fine. Sorry, that's wrong. That's incorrect. There are other markers that have to be looked at, or you can miss the whole issue, and a person could suffer for their entire life because nobody ever checked certain things. All right. Well, hopefully everybody got some great stuff out of this. God bless and have a wonderful day. Also, do share us whenever you can. A lot of people need this information. So, all right. Have a wonderful day.